Hello, my name is Michelle Musa-Moons, and I'm an IBD specialist at the University of Michigan. Welcome to the IBD School 200 series. In this video, we will be talking about Clostridium Difficile, CMV, and other infections that look like IBD flares. Both ulcerative colitis and Crohn's disease can have acute flares. Sometimes these flares come out of nowhere, but they can be prompted by infections. Certain infections are known to be associated with acute disease flares, including most commonly Clostridium difficile infection, but also other bacteria and viruses such as cytomegalovirus or CMV. Clostridium difficile is a bacterium that lives in the environment. It can sometimes live in people's colons in small amounts and not cause a problem. However, if it overgrows, it becomes a predominant bacteria in the colon and can then cause inflammation along the lining of the colon. This is because the bacteria produces toxin molecules that trigger inflammation. For people who have inflammatory bowel disease, either Crohn's colitis or ulcerative colitis, it can lead to significant inflammation and also trigger a flare of their inflammatory bowel disease. All patients with a severe IBD flare should be tested for this infection, since catching it early and treating early can greatly improve outcomes and improve the response to IBD medications. We will discuss how to test for this bacteria and options for treatment in later videos. Other infections that can mimic or trigger an IBD flare include viruses. One virus that has been clearly associated with acute IBD flares and poor response to IBD treatment is cytomegalovirus or CMV. This is a very common virus that can affect anywhere in the body, including the lining of the colon. Many people have been infected with this virus in their lifetime without any problem. However, initial infection with this virus can trigger an IBD flare that does not respond well to steroids or immunosuppression. Furthermore, immunosuppression can lead to reactivation of dormant virus from an old infection. It is important to think about CMV infection possibility in any patient with an acute flare because it would be treated differently than a routine flare with antiviral medications as well as routine IBD meds. Testing for CMV and some of the other viruses can be done with blood tests, but those blood tests aren't very good at detecting colon infection. So your gastroenterologist may recommend a flexible sigmoidoscopy or colonoscopy to obtain biopsies. A pathologist can then look for CMV or some other viruses in the biopsy specimen. I just want to close by emphasizing that we usually need to treat both the IBD flare and any infections that might have triggered the flare. IBD medications are targeted at cooling off or turning down the immune response that is out of control and causing damage, while antibiotics or antiviral medications can help clear the infection that might have triggered the immune response. One newer form of testing to come out recently is called a GI PCR panel, where instead of testing for 1 or 2 different bacteria, we actually have a panel of 15 different bacteria, viruses, and fungi that we can check for. This is a relatively new test, but we are finding that a lot of our patients' flares may have been tipped over by some sort of bacterial infection that was previously not detected. We hope this will help us to tailor therapy for acute flares and improve outcomes in the future. I'm Michelle Musa-Moons, and I thank you for watching IBD School.